Hey everyone, I am sitting right next to the Chattooga River, and believe it or not, I did not get here on my kayak. I hiked. I wanted to bring my dog out here. It is Election Day 2022, and South Carolina teachers have off, so I went and voted, and I'm out in the woods because in 6 days I am having hip surgery. I've been dealing with hip pain for now, I don't know, between 6 and 8 years. I've honestly lost track of how long I've been in pain, but I foolishly never wanted to pay for an MRI. This year I've had a number of medical procedures, so it made sense to go get an MRI, and to my surprise, all three doctors that have looked at the MRI believe that I have a torn labrum and possible impingement. So I've made the decision to go to Columbia, South Carolina to have this surgery done in just a few days, 6 days to be exact. And so I want to do a little series of, what I'm feeling, what I'm going through, so that maybe this can help other people. I know talking to other kayakers and other folks that have gone through this, it's helped me so far. So let's talk about, there's my big old Roddy enjoying the water this fantastic warm November day. So let's talk about some of my symptoms. So there's definitely been the mass majority of this journey that it's not been debilitating, and then other times that it's absolutely been debilitating to the point where I can't sleep. My number one complaint would be deep socket pressure. The second symptom would be a clicking, like when I swing my leg, it does not rotate smooth at all. And then that progressed into what felt like the femur popping out of socket and back in. And I'm told that is true. That was happening. When that started, it was this like thunderous pop. It really felt like it was rattling my brain, to be really dramatic about it. I don't have that big popping anymore. However, I do have small popping, even just sitting back to use the toilet to go to the bathroom, it pops. But it doesn't hurt. In fact, it relieves pain, and I'll do it on purpose, and I'm told I'm just doing more and more damage, but it's what makes it feel better at the moment. I have no idea how I tore my labrum, and, a lot of people, if you don't know me, I'm super active, probably average of 5 days working out a week. Majority of that is whitewater kayaking, and as of this summer I really started to get into road biking, so those are my two main activities. I do lift weights, but I haven't been in the weight room lately, really. So most people would say just stop kayaking or slow your roll, which isn't really a possibility for me if you know me at all. And kayaking really doesn't make it worse. There's no rhyme or reason. I can't pinpoint what makes it better or worse, other than there's two main things that make it worse. Driving is the worst, hands down. Any amount of time in the car absolutely crushes my hip. And the second thing would just be standing for long periods of time, which I'm a PE teacher and I'm on my feet all day long. My headspace is probably not the best going into surgery. Of course, like anybody going into surgery, you're worried that you're going to do this big procedure and things aren't going to get better, that maybe they get worse or they stay the same. So that's a fear. I am so active that this last winter I had carpal tunnel surgery. I was just out of a kayak for 2 months and I was going out of my mind, and I did a lot of hiking then. So this, I'm told, 6 to 9 months recovery, 3 weeks on crutches, and then after that in a brace. I'm allergic to pretty much all pain meds, so it's going to be an all natural thing. So I'm obviously worried about my pain threshold, not being able to move, not being able to get out in great outdoors like this. but I am trying to keep a level head, knowing that I'm doing this for my future. Told that I would be a candidate if I was older for full hip replacement, so that's probably in my future, and this is prolonging that, and hopefully it's a successful surgery and I don't have much pain at all and can drive again and stand without pain and get back in a kayak and regain the strength that I'm going to lose in that time period, and just kind of have a new outlook on life and legs and wheelchairs and crutches and walkers. So follow me on this journey. If you've got any comments for me, leave them below.